Hello everyone, welcome back to my channel. So in this video we will talk about the action of 5-hydroxytryptamine. So it is a potent depolarizer of nerve endings and it exerts its effect directly like reflexly or indirect effect. So we will talk about the overall effect first. So on CVS, the arteries on action by 5-hydroxytryptamine they are constricted. That is a direct action because it act on the vascular smooth muscles. Okay, but they are also dilated because of production of EDRF by the action of 5-hydroxytryptamine. So it depends upon the vascular bed and as well as the basal tone. So in addition, it also releases adrenal from adrenal medulla and it involves in ganglionic transmission and it evokes a cardiovascular reflex, and the net effect is very complex. So the larger arteries they are constricted, and in microcirculations the arterioles these are dilated, and the venules they are constricted. So venules are constricted and these are dilated, so blood will accumulate here and the capillary pressure will start rising and fluid will escape. Okay, so a triphasic response is classically seen when we inject 5-hydroxytryptamine in animal intravenous injection. That the three phases are early sharp fall in BP, then there are brief rise in BP, and there is a prolonged fall in BP. So this early sharp fall in BP is because of coronary chemo reflex. In the last video, we discuss about coronary chemo reflex, which means it is bradycardia. Obvious. So bradycardia, that is fall in BP, that is because of withdrawal of sympathetic tone. Also there is apnea or respiratory stimulation that is elicited by stimulation of receptors in the coronary bed. And this brief rise in BP, that is because of vasoconstriction and cardiac output increase, and prolonged fall in BP is because of arterial dilatation and extraction of blood. So now we will discuss about the overall action on visceral smooth muscles. So this 5-HT, this is a 5-hydroxytryptamine, it's a potent stimulator, and by both direct action as well as indirect action on the gut. It increases peristalsis and increases the secretion, and diarrhea can occur because of increased secretion, and also it constricts bronchi, but it is less potently by histamine. So now we will talk about the overall effect on gland. So 5-hydroxytryptamine it inhibit the gastric secretion but increases the mucus production, and अगर mucus ज़्यादा बन रहा है तो ulcer होने के chances they are very less, so it has a ulcer protective property. Now the action on nerve ending and adrenal medulla. So afferent nerve ending, if afferent nerve endings are being stimulated by it, so there will be a tingling, pricking sensation as well. Pain will be associated with it, but these are less potent than histamine in releasing catecholamines from adrenal medulla. So on respiration, there is a brief stimulation of respiration, mostly reflex through bronchial efferent, and hyperventilation are usual response, but larger doses when injected intravenously they can cause transient apnea through coronary chemoreflex. We had discussed it earlier. Okay, now the effect on platelet. By acting on 5-HT2A receptor, 5-HT causes change in the shape of platelet, but they are weak aggregators. However, it does not induce the release reaction. Now the effect on CNS. When 5-HT is injected intravenously, it does not produce any central effect. Why? Because of poor entry across the blood-brain barrier, and it serves as a transmitter primarily inhibitor transmitter. Okay, direct injection in the brain, it produces sleepiness, change in the body temperature, hunger, a variety of behavior effects. Now we will discuss about pathophysiological roles of serotonin or 5-hydroxytryptamine. First, we will discuss about as neurotransmitter. So it is a established neurotransmitter in brain, and the brain 5-hydroxytryptamine, it has a fast turnover rate. Okay, so it forms very easily, very quickly, and it is present in raphe nucleus of brainstem, substantia nigra, and few other side, and they send axon both rostally as well as caudally. Rostally to limbic system, cortex, neostriatum, as well as caudally to spinal cord. Okay, and these are involved in sleep, temperature, thought, cognitive function, behavior, mood, vomiting, as well as pain sensation we had discussed earlier. So now we will discuss this action as precursor of melatonin, and these are precursor of melatonin in pineal gland, and they are believed to regulate the biological clock, that is the action of melatonin, and it maintains a circadian rhythm. So now the neuroendocrine function, the hypothalamic neuron, which control the release of anterior pituitary hormones, are probably regulated by serotonergic mechanism. Now nausea and vomiting, these nausea and vomiting, when they are specially evoked by radiotherapy or cytotoxic drug, these 5-HT and the action on 5-HT3 receptors in gut area postrema and nucleus tractus solitarius, and they causes nausea as well as vomiting. In migraine, 5-HT is said to initiate the vasoconstrictor phase of migraine and to participate in neurogenic inflammation of affected blood vessel. Okay, so there is a drug which is somatriptan. We will discuss about it later, but it is a 5-HT1D 1B agonist, and it can control an acute effect of migraine. However, the role of 5-HT in this condition is not precisely known. Now, in hemostasis, so in hemostasis, platelet releases 5-HT during aggregation at the site of injury to blood vessel, and actin in concerned with collagen and other mediated, the 5-HT it accelerate platelet aggregation and clot formation, and thus serves to amplify this action. And the contractile action appears to promote retraction of the injured blood vessel, and both these action together, they contribute to hemostasis. Now Reynolds phenomena, release of 5-HT from platelet may trigger acute vasospastic episode of large arteries which are involved in Reynolds phenomena, and quetiapine has prophylactic value in it. Now in variant angina, along with the thromboxane A2, 5-HT release from platelet have been implicated in causing coronary spasm, and because of that variant angina. So now we will talk about carcinoid syndrome. What is carcinoid syndrome? Firstly, we will discuss about carcinoid tumor. So it is a slow growing cancerous tumor that can grow in several places throughout the body. A carcinoid tumor often begins in the stomach, appendix, in the gut. And carcinoid syndrome means it is a pre-neoplastic stage in which there will be the carcinoid tumor, it will produce massive quantities in of serotonin, and the bowel hypermobility, motility, and bronchoconstriction are the features of this carcinoid which appear to be because of 5-HT. And plagra in carcinoid, why does plagra happens? Because of deficiency of tryptophan. Agar tryptophan will go to make more serotonin, so it will be deficient and plagra will occur. So plagra in carcinoid may occur due to the diversion of tryptophan for synthesizing 5-hydroxytryptamine. So that's all for this video. Thank you. Please subscribe to my channel and hit the bell icon.